Welcome to the Stay Healthy El Paso podcast, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. This podcast is presented to you by Dr. David Midoff, expert physical therapist and owner of El Paso Manual Physical Therapy. It is our goal and intentions to provide you with valuable tips and insights from experts in the El Paso area so you too can stay healthy, fit, and energized. Now here's your host, Dr. David.
Hey El Paso, welcome to the Stay Healthy El Paso podcast. I'm your host, Dr. David Midoff, specialist physical therapist from El Paso Manual Physical Therapy, and I'll be talking to you today about the 3 most important exercise tips when repairing knee cartilage. Now, knee cartilage problems often cause achiness, pain, crunching sensations, grinding sensations. Those types of knee cartilage problems are completely fixable. Now, I'm not saying that the crunching or grinding can go away, but it can reduce in pain and discomfort. You can reduce any swelling that you've got going on. And most importantly, it is possible to get back to exercising, to going up and down steps, to doing the things that you love to do without worrying that you're gonna end up having some surgery later on. Now, unfortunately, a lot of people in the medical field don't believe that it's even possible to fix a knee cartilage problem. And often when patients go to see them, they resort to just treating the knee cartilage problems with medications, injections, and surgery. In fact, surgeons that do procedures that are designed to clean up knee cartilage problems often tell their patients that they'll need a knee replacement at some point soon, within a few years or a decade or so. But they don't offer a way to naturally help the knee cartilage problem because that's just not what they went to school for. That's not what they trained for. So they're just usually not even aware of it. And in fact, they may even see people that attempted to fix their knee problem on their own naturally and didn't successfully do it. And so they're back in the clinic, and it just validates their perception of the fact of it validates their perception about that it's not possible to heal a knee cartilage problem naturally, that it's just going to get worse over time no matter what. But the truth is that it is possible to repair knee cartilage using exercises. We do it here in the clinic all the time. What's important to note is that there is no one exercise that works for everybody consistently every time. It's a series of exercises all bundled together in a process. It has to happen gradually over time, and that process needs to be adapted to your specific situation, depending on how severe your knee cartilage problem is and how weak other muscles are and how you move, what goals you want to get back to. There's all these factors that have to be accounted for in properly recovering a knee cartilage problem that you might be dealing with. So I'm going to cover with you today the 3 most important exercise tips when repairing knee cartilage. Number 1, take pressure off. Specifically, take pressure off the kneecap. Knee cartilage problems often happen when the kneecap is pressing way too hard against the end of the thigh bone where the joint is, where the surfaces of the bones meet. Oftentimes it's the quad muscles, the quadricep muscles, the muscles in the front of the thigh that are too stiff, too tight, too strong, and yank that kneecap up against the end of the thigh bone way too hard. Over time, that begins to degenerate the cartilage on the back of the kneecap or on the front of the thigh bone and cause there to be too much pressure, too much bad forces, and that's how the knee cartilage problem develops. So if you feel like that's your situation, then what you need to do is just lay off. Do less walking, do lower intensity activities. You might, a lot of people that we talk to that have knee problems, they try walking for exercises to fix their knee problem. Stop doing that. You need to do things that are not aggravating to your knee so that you can take off the pressures from your knee. In fact, if you've been actively exercising your quadricep muscles, those thigh muscles in the front of your thigh, stop doing that because it's likely putting too much pressure on the kneecap. So take pressure off your kneecaps. Number 2, lots of light reps. What I mean by that is cartilage is stimulated to heal by taking on pressures, by taking on light pressures. Now think about this. If your skin can take pressure, for instance, if you think about calluses, if you go lift weights or you do some housework or yard work and you are using a broom or some tool with handles on it, you start to get callus on your hands. That's your skin's response to doing an activity that puts a lot of pressure on the skin. And of course, if you do it in the right way, your skin gets a nice callus that allows you to be able to do that job over and over again without messing up your skin. Well, cartilage has to do the same thing. So you need to put the appropriate amount of force on the cartilage so that it thickens and gets more dense, so that it can take on the forces that you need to put through it for your everyday normal activities. But if your cartilage is very irritated right now, it's just like if you have irritated skin. You just can't put a lot of pressure on it. In fact, you have to put way lighter than normal pressures on it to accommodate it. So if you've got a lot of pressure on your kneecap right now and you want to put some light reps through it, you got to do super duper light stuff like biking with zero resistance, like on a stationary bike. That might be an option. Walking is probably going to be too much. Tailgate swinging is an exercise that I've talked about in other videos. You can go check out our playlist of videos on our YouTube channel if you want and find what I mean by tailgate swings. And shameless plug, we've got a program called the 28-Day Knee Health and Wellness Boost Program where I talk all about tailgate swings and other exercises that help to heal knee cartilage problems. But back to what I was saying, it depends on the intensity or the irritation level of the cartilage. So if your cartilage is actually not that irritated, then maybe walking can be a high repetition, low intensity or light exercise that you can do. Now we're looking at doing reps in the hundreds at this point. So if you are able to do light reps, you got to do hundreds of reps. So I'd say 200, 300, 400 or more reps, which you might not be counting the reps, you might more so count the time. And that might mean walking for 20 minutes or cycling for 20 minutes or tailgate swinging for 20 minutes or more. And you can spread this out throughout the day if it's a lot to do all at once. But it should not hurt you to do this activity. It should just kind of warm up your knees. It shouldn't make it painful at all. And if you do that, if you give your knee cartilage light reps over time, you should put it in a position where it's going to stimulate healing and it can make the cartilage more dense so that you can take on more aggressive activities, and it's a good thing for your knees, not a harmful thing. Number 3, get strong. So if you've been able to take the irritation off, if you've been able to control the flare-ups or the inflammation that you have initially with a severe cartilage problem in the knee, and then you've done light reps on your knee, exercise that just puts light pressure through the knee joints, and that's worked out for you, then the next step is to progress your strength in muscles that influence good movement in the knee joint. Now specifically, you're going to want to work out your glute muscles way more than your quads in just about 99% of cases, so that you don't put more pressure through your kneecaps. But you do need to get strong. You need to think about being able to get up and down from chairs easily. If you're the type that needs a few chances to swing your body weight back and forward and then get up out of the chair, that's not good. You need to be able to get up right out of the chair, and chances are you're missing strength to do that. If you can't tolerate standing more than 10 or 15 minutes just because you get tired, that's a sign that you're probably pretty weak as well. Maybe you're more fit than what I'm talking about and you're able to do all that stuff, but you haven't worked out in a while and you probably need to strengthen more from where you're at so that this knee problem isn't going to come back. So get strong in the right muscles to ensure that your knee cartilage is healthy. The reason for this is because as you get stronger and you put good forces through your knee cartilage, it thickens, it densifies, and it allows your knee cartilage to absorb more aggressive forces without becoming irritated. Essentially, you build a margin for being able to tolerate bad forces through your knee, so you protect it. And this protection is what allows you to avoid having a surgery later on or avoid taking medications or injections because of a knee problem. Now, that being said, you might still have sounds coming from your knees whenever you go up steps or down steps or squat down to get something from the ground. That's okay as long as it's not painful, then you're okay. Well, thanks for listening to this podcast. I hope that you learned a lot. If you're at all interested in resolving your knee cartilage problem, then I encourage you to check out the notes about how to get to the 28-Day Knee Health and Wellness Boost program. That program is packed with great information about how to exercise, how to rest, what not to do, what to do, and it's a guided procedural type program where you can know exactly what to do. I walk you through step by step how to do it, and you can access this 24/7. So if you're a late night person or early morning person, or you just kind of like to fit it in whatever parts of your day, it's completely on demand. You can decide when you want to start it, and you can repeat it if you want to go through it a few times. I encourage you to do that because you'll get more benefit for doing it more times if your knee problem is really severe. Another option is if you want us to help you directly, if you're in the El Paso area, then call our clinic at 915-503-1314 and let us know that you heard about us on the podcast and that you want to get in touch about how we might be able to help you out in person with solving your knee cartilage problem. We're happy to do that. Guys, I hope that you have a wonderful day and stay healthy, guys. See you soon. Bye-bye.
Thank you so much for listening to the Stay Healthy El Paso podcast, brought to you by El Paso Manual Physical Therapy, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. If you'd like to learn more about what El Paso Manual Physical Therapy can do for you, call 915-503-1314 or visit our website at epmanualphysicaltherapy.com. Mention this podcast for a free discovery visit valued at $100. If you enjoyed what you've heard, please be sure to leave a review on iTunes and follow the show on your favorite listening platform so you won't miss an upcoming episode. Tune in next time to get the best health tips from experts in the El Paso area.